For a business, pain is a whole range of things. I think that it's day-to-day things happening that doesn't align with their vision and values. It can be from a manager or supervisor feeling like they don't have the tools. And then at a simple level, a painful person is someone who physically feels pain, loses function. It impacts their home life, it impacts their ability to play with their kids, go for a ride and come and perform day to day in their job.
You can't pick up your kids, give them a cuddle, you can't mow the lawn, you know. There's a lot of chores at home that you probably can't do that need to be done because everybody's life's done just stop when they leave work. But I don't like being injured, I like to help the blokes get home to their families, you know what I mean?
Well, reactive injury management looks like the business starts intervening at the time when an injury report is filled out.
What is one of the biggest drivers of the other pain in the business, like your premium? That gives you a clue about where you need to direct your solution.
The traditional business has measured health by looking at a financial balance sheet or profit and loss and going, yep, that's a healthy business. Those days are gone. You've got to have a healthy business through every aspect of the business.
We've been obsessed with taking workplaces from this reactive to preventative and predictive phase of their business.
A couple of years ago, when I first started the business, we had not a very good safety record with injuries quite frequently, to the point when I first started we were having one medical treatment per week.
Our total recordable injury frequency rate was standing at 187 man-hours per million hours worked. Now, with the guys buying into the safe systems of work, down to zero for the last 8 months.
Since we started this, we've actually increased our productivity in the factory and capacity by about 50%. So, you know, that alone is quite significant.
It's a multifaceted program. It's not just a program to deal with the injury. It's about dealing with lifestyle, aligning the job function to the capabilities of the individual. And that's where significant benefits can come from.
We don't just roll out an isolated on-site physiotherapy program. We roll out the program that actually aligns with the business values, the business vision and the business strategy.
It's an engaging program across the entire organisation, delivering a good outcome for the business, but it's delivering a great outcome for the customer as well.
Instead of focusing your resources at injury events, you're now focusing your resources at the health of your entire workforce.
We use our data capture and our systems in order to be able to predict over time which people are at high risk and use that to drive proactive behaviours in the business.
We find that change in the business is normally very fast, and particularly because an on-site program is so obvious. All of a sudden there's a physio in your workplace. It causes immediate interest and immediate engagement.
The team has delivered that outcome for us.
We do find that job roles change, so where some people were very much about doing paperwork around injury management, that their role then changes to be more focused on proactive preventative approaches.
We come across lots of people who feel like they're stuck in a rut. They feel like every day is a fight, new injuries, new claims, the old way of thinking is not working and they just don't know what to do. I think that seeing is believing. Okay, so often the best way to see the new way is just to come out and have a look. You don't have to believe me, come and see it in action.